We're recording. So today is the 17th of July, and so welcome back to all of you to the Division of Child and Adolescent Psychiatry academic program. After a little break for everyone, I think most people spent their time being preoccupied with the coronavirus and all the challenges that it's been posing us. And so we thought it was very relevant that Dr. Jasper van Zyl, one of our registrars, would want to pick a topic to talk about, which he calls problematic internet use. Now, I'm not going to assume that Jasper wants to talk about all the headaches we've all had over the last 3 months trying to connect to the internet, because we've all been driven to technology because of coronavirus. But Jasper, I think this is a very topical and a very relevant theme to talk about in a mental health setting. So well done for choosing to talk about this. And I think everyone's very much looking forward to your presentation. So please feel free to take over and start sharing your screen.
Thank you very much, Prof de Vries, and thanks to everybody for coming. Like Prof said, I thought this morning, let me just see if I can get this started. There we go. So can everybody hear me? Is that okay? Right, so I thought this morning, once again, thank you to everybody for coming and welcome to this presentation this morning. As Prof said, I thought we'd discuss this concept of problematic internet use for this morning's talk. It certainly is something that's becoming more and more of an actual and a topical issue for our kids and for our teenagers. And certainly in clinical practice, it's something that we're already seeing, and we all have a sense of it. And certainly it's a problem that's going to become more and more topical as time goes by. When I was preparing this presentation last night, I became mindful of the fact that it's not quite a narrative and a linear talk today. I actually thought it might be a lot more helpful to introduce some of the concepts and to introduce some of the ideas, and then for us to have a little bit of a discussion afterwards, to share some ideas about how we have experienced this problem in our practice, ideas about how we can help our teenagers and our kids guide this new realm of their lives. When it comes to internet use, it's a ubiquitous thing. But I think that if you consider what is said about it in the media, certainly from parents, sometimes from the kids themselves, this pattern of excessive internet use and problematic internet use is very often characterized as being an addiction of some kind. And so I thought that might be a nice place to start, and to just say something about this concept of internet addiction. You'll see I put it between quotation marks, and there's a very good reason for that, and that is that there actually is no such thing as internet addiction. And so that actually concludes my talk, and I want to thank everybody for coming. I think we'll have some tea upstairs, and then we'll go and have a nice weekend. But on second thought, though, I see I do have some more slides to go through, because the thing about internet addiction is that while there is no such thing, there actually is such a thing, kind of. What I mean when I say internet addiction is to be put between quotation marks, it is because we just can't call it an addiction as such yet. So in the DSM, we actually cannot diagnose internet addiction, although it is something that has been proposed to become a part of the DSM and a part of our conceptualization of mental illness in terms of the DSM. This has not yet happened, and there are plenty of reasons for that. There's some controversy about whether excessive internet use and this internet addiction truly represents a true form of addiction from a neurobiological point of view, and whether or not it can actually be put into the same category as something like a substance use disorder, pathological gambling, and those kinds of conditions that have a real clear neurobiological addiction framework. There's also controversy about whether this condition should be considered a separate clinical entity, so an entity by itself, or whether it's a manifestation perhaps of other psychiatric conditions or even just psychosocial circumstances. There's also no universally standardized or agreed upon definitions to define this condition clearly. Although in the future, there is some indication that internet addiction in some shape or form will become a diagnosable condition. The current term that we use for this pattern of excessive internet use is problematic internet use, or PUI. And this morning I want to spend some time speaking about problematic internet use. More specifically, I want to zoom into social media use, because that is the pattern of internet use that is most common and most commonly seen with our teenagers, definitely in a clinical setting. Before I do that though, I do want to take a little bit of a U-turn and show you something interesting, which is that in the DSM, there actually is an internet-related condition that we can diagnose. This is called internet gaming disorder. So internet gaming disorder is a problematic pattern of internet use, which we'll go through quickly, but specifically related to the engagement in internet gaming. The way the DSM frames this disorder is very much an addiction type disorder. I'll tell you what I mean. It says that it's a persistent and a recurrent use of the internet to engage in games, and that this, in fact, causes impairment or distress. It then goes on to say that there are certain criteria over the past year: preoccupation with internet games, there's some withdrawal symptoms developing when you can't access it, there's a degree of tolerance, so there's need for more and more internet gaming, there are unsuccessful controls to attempt this, loss of interest in previous hobbies, continued use despite psychosocial problems caused by this. There's deception towards family members or other people about the amount that you're actually playing. There's also the use of the internet to escape or relieve a negative mood, and the jeopardization of relationships or of occupational or educational opportunities. So we can see that the DSM at least has some sense of this, of internet use as having possibly an addictive component to it. I'm not exactly sure why the DSM chose to include internet gaming specifically. I'm sure there's some history to it, and maybe some of the consultants can say something about that if they have any information. But I thought that was just an interesting aside for 1 second, just to get us thinking about the framework in which we are speaking. But getting back to problematic internet use, or PIU rather, this is a term that's now widely used and accepted in various contexts. It's also the preferred term of IACAPAP, of which Prof is a member, which is an organization that specifically looks at child and adolescent psychiatry. What's nice about this term, I think, is that it's neutral. And so by itself, it doesn't imply psychopathology per se. It refers in a broad sense to this internet use pattern that we're seeing that goes beyond the scope of just so-called positive internet use and leads to negative consequences. But more specifically, it's defined as being a maladaptive preoccupation with internet use that's experienced as irresistible and for periods of time that's longer than intended. This then causes significant distress or impairment, specifically resulting from this internet use. And a part of this term and this diagnosis is that there's an absence of other psychiatric psychopathology that might explain this excessive internet use. For instance, if your excessive internet use or problematic internet use stems from an OCD kind of disorder, and actually using the internet for you in your specific circumstance is an obsession or a compulsion, or in the context of mania, where the problematic internet use results from somebody spending more and more time on the internet due to increased energy or the search for novel interests, that would not fall into the category of problematic internet use in the way that we use it here. As I said before, there are many different ways in which this problematic internet use manifests. There are lots of problematic ways in which to use the internet. There is, for instance, the use of the internet for purposes of gambling, or for purposes of illegal activity, or for purposes of accessing pornography, or for accessing all kinds of different information that might in a sense be problematic. But for our purposes, I think all of us have the sense that social media and social media use, when it comes to kids and to teenagers, is probably the most common and the most important form of this, at least for the time being. And I want to make you aware of this research that was done by the Mayo Clinic and the Pew Research Center. It's obviously American data, but as we know, where America goes, so goes the world. In America, 97% of teenagers, so just about every single one, uses some kind of social media platform. These platforms include YouTube and Facebook, Twitter, Instagram, or Snapchat. I'm not sure if Snapchat's really caught on in South Africa. Maybe maybe it will in the future. But what's important is that this figure is up about 24% from just 5 years ago. And what's even more interesting from this data is that 45% of those teenagers polled claim to be online almost constantly. So certainly a very big part of their lives, definitely a big part of their inner lives. And that is, of course, where the situation becomes interesting for us. So as part of that research, 31% of the teenagers polled said that social media had a mostly positive effect on their lives. 45% were kind of neutral about it, and 24%, so about a quarter, said that it had a mostly negative effect on their lives. So when it comes to the positive effects, the kids said things that I think are relatively self-evident. They said that they used social media to connect with their friends and their family, saying it's easier to find info, saying that they could meet other people with the same interests as them. Some said it was a form of entertainment for them, a form of self-expression, or a way to get support, a way to learn new things. And of course, there are other things about social media as well that could be positive in these kids' lives. The benefits of social media are clear. We can see that for teenagers, there's a degree of socialization and communication with peers. We can say a lot about that, but it certainly is true that accessing social media makes access to other people a lot simpler, and communication with people a lot simpler. There's also engagement with a wider community, meeting people you would never meet in real life. You would never meet in any other forum than on social media. There's the opportunity for kids to get involved in fundraising and volunteering and political engagement, philanthropy. They can share creative endeavors. Their ideas can grow, and they can connect with a more diverse group of people than they normally would. The enhanced learning opportunities are self-evident. And also, teenagers access health and other information mostly through social media at this point. This is an important point because whereas before this information was accessed through schooling, through their parents, now accessing information about health conditions, about mental health conditions as well, mostly takes place online. But moving on to that group of kids who said that social media had a mostly negative effect on their lives. 27% of them said that this was because of bullying and rumors spreading about them. Another group said that it harmed their relationships because there was a lack of in-person contact, which they found to be harming their relationship. The third one, I think, is a very interesting one, and we'll spend some time speaking about it, is that social media creates an unrealistic view of other people's lives. Some said it causes distraction. Some even use that term addiction that I so thoroughly debunked by putting quotation marks next to it. Some said that peer pressure was a significant issue. Some said that it caused mental health issues. And then one of the answers there is my favorite of all of them. It's so very teenage. So that it just causes drama in general. And of course, there were other negative effects that some kids also found. To think a little bit about the risks of social media, obviously all of the above reasons that the kids gave were valid reasons and were a part of their realm of experience. But there are some other risks to social media use as well. The first would be that excessive or problematic social media use could lead to a neglect of your real-world responsibilities. Kids and teenagers have academic responsibilities, they have social responsibilities, they have home responsibilities, which obviously can get neglected if they spend too much time on the internet. The second point is, I think, something that we've been seeing in our clinics and we've been seeing with our parents, is that kids use inappropriate means to access more online time. I frequently see in the clinic that some of the parents almost bribe their kids with data and with internet time, and other parents have found ways to in a more appropriate way use the internet as positive reinforcement for good behavior. The third thing is about cyberbullying and online harassment, which is becoming more and more of a problem. It's something you encounter a lot in the media as well. The fourth point is something that I think is going to become more and more of an issue, and we're seeing it in our daily lives more and more, is this concept of a cyber footprint. The idea that if you put something online, it's there forever. And we're seeing even today that people are having occupational, social, interpersonal problems because of things that were written online or said online many years ago. And when it comes to teenagers, I don't think we have to be. I think all of us can understand that when you're a teenager, you're developing your ideas, you're developing your sense of identity. And sometimes you come across ideas that make a lot of sense to you at the time. Maybe you feel strongly about them and you express them online. And maybe as you grow older, your ideas about things change and they get more nuanced. But in terms of the cyber footprint, because it's written in black and white, there's very little that you can do to explain that if it comes up later in your life. Sexting is another big problem. 20% of American teens say that they've sent or posted nude or partially nude pictures of themselves over social media. I think the risks of that are self-evident. And of course, there's economic risks to social media as well, being influenced by social media influencers or by companies to buy products and services that you wouldn't normally buy. But what about the psychological effect of social media? A couple of years ago, there was a report by the American Pediatric Association that spoke about something called what they called Facebook depression, something the media latched onto. You found some articles about it, which was a pattern of anxiety and depression that were being picked up by pediatricians in the States that appeared to be primarily related to social media use. And when they prodded this concept a little bit, again, it's not a diagnosable condition, and don't quote me on this, but when they prodded into this narrative a little bit, they found that one of the most important drivers of this anxiety and depression was this idea that social media creates this unrealistic view of other people's lives. And for teenagers, this is of course very important, because when you're an adolescent and you think about Erikson's stages of development, teenagers are in that part of their life where they are supposed to create their own identity. And they're looking for an identity for themselves, something that's unique about them. They're looking for this idea that their lives are interesting and worthwhile, and that they themselves are worthwhile to continue developing and to continue living. And when you think about the online lives of other people, you think about social media profiles and social media avatars. Social media, in a real sense, really just is this glossy show reel of your friends, your family, your acquaintances and celebrities. It's a portrayal of an idealized self. And on social media, there's this tendency to downplay feelings of sadness, feelings of worry, and to show people the bad days. You very rarely see people on social media putting up photos of funerals or putting up photos of just a boring day. And if they do, it's still infused with this idealized picture. I think this tendency might be changing. You are seeing people reaching out over social media on days that things might not be going so well, but you oftentimes get the sense that this is done with a purpose other than expression, that it's done with a purpose of, again, showing some kind of idealized self or looking for help in ways that are exaggerated or not authentic. But of course, watching these online avatars, social media influencers, and even your friends and family leads to a really distorted image that other people are happier, they're leading more exciting and more successful lives than you. And then, of course, this leads into this really negative online behavior. And it's especially important when it comes to the teenagers. Teenagers might start obsessing about their virtual identity and their avatar and how they are perceived by other people. They might have envy activated by observing other people's lives. They may start posting frequent status updates, interacting excessively, fishing for likes in a sense. And of course, the obvious one of just negatively comparing your life to the lives of others. So the interplay that we should be thinking about here really is, what is the effect of social media on mental health? Can social media influence your mental health state? I think it's self-evident that it can. And even if problematic internet use, problematic social media use is not a diagnosable condition on itself, it certainly forms a part of the depression or anxiety narrative that a lot of our young people are having. And then, of course, what's especially important when it comes to teenagers is, what is the effect of mental health on social media use? When teenagers struggle with mental health issues, they struggle with their sense of identity, maybe they have a diagnosable psychiatric condition, this may influence the way in which they use social media. That may lead to detrimental effects as well. Don't want to say too much more about that. I think that's something interesting to speak about after the talk. And so actually I want to finish up my talk. I want to wrap up by asking the question, what can we do to support teenagers in internet and social media use? And again, this is something that our clinicians here might be able to have some more great ideas about. The first thing is that we should encourage caregivers and teenagers to learn as much as possible about the internet. We should teach parents to become familiar with social networks, blogs, and other tools. And we should encourage parents and caregivers to talk about internet use in a positive way rather than just by checking up on their teenagers. Parents should certainly establish basic rules about the time that's spent online, and they should establish some basic rules about the kind of information that kids access. What flows out of that is, of course, there should also be some basic rules about the kind of information that's given out. Certainly teenagers should be very wary to give out their personal demographic information or financial information about themselves to anybody that they don't know and to anybody that isn't secure. Reminding teens to use secure settings online can be very helpful. And I think it's important for caregivers and parents to pay attention to behavioral changes that could be related to this problematic internet use. Definitely secretiveness on the part of their teenagers and their kids, definitely increased time that's spent online. Sleeping problems, I think, is a big red flag for these kinds of conditions. And of course, teenagers and kids who have inappropriate sexual knowledge for their developmental stage should also raise the alarm for parents. My last slide here really is just about thinking about additional treatment options. The patient comes to us, and this is a big part of their presentation. The question is, what should we do? Is there treatment? And the answer is that there is no one-size-fits-all approach to this problem. It's obviously important for us to diagnose and treat any underlying psychiatric conditions that can influence internet use. There are some behavioral interventions that can be appropriate. I think for the most part, your basic behavioral interventions and behavior modification could be very useful in this regard. I think the most important thing of all is to equip kids with information, with support, and very important to keep an open mind about the internet and to be able and to be available for our kids and teenagers to approach us with any problems that might pop up. And so that concludes my talk for this morning. Thank you very much for listening, and thanks to everybody for coming. I hope that was helpful. I hope it was informative, and I thought perhaps we can have a little bit of a discussion and just share some experiences and some ideas on this topic. But thank you very much.
Great, thank you, Jasper. Would you mind stop sharing your screen? Lovely, thank you. That's great. Well, I think you were talking about problematic internet use in young people, but I think what you talked about is relevant to all of us, particularly over the last 3 or 4 months, where I think most of us have spent far more time on internet and on social media. And I've looked at things that I never thought I would look at. I don't mean inappropriate things, but you look and you search and you find things that are really not appropriate. And I think there's a message for all of us in there. So thank you very much for that. I'm going to stop the recording now, and then I will open it up for questions.